Good afternoon, everyone. Thanks for being here. I am Pam Schaff. I'm the director of the HEAL program, the Humanities, Ethics, Art, and Law program. And I'm thrilled to welcome you to our first Art and Medicine event of 24-25. So today's event continues our program's mission to align the work of artist patients with the core medical school curriculum. And we do that to foster understanding between patients and future health professionals. And today we're so fortunate to have our guest, who I will let Ted introduce in a moment. Ted Meyer is our artist in residence. He's been with USC since, I think, 2016. Is that right?
Yeah, I think so.
All right. And Dr. Rao is with the Division of Pulmonology here at USC, and he's going to represent a clinician's point of view. And at this point, I'm going to turn things over to Ted, who will introduce our artist.
Hi, everybody. Welcome. Happy. Nice to see all the new students. So, Miranda Fae, Fae. Okay. You went to San Francisco State. Got your undergrad art degree?
In child and adolescent development.
Oh, no, I have one. Oh, I thought you had started art all the way back then. But now you're at Otis.
Now I'm at Otis, yes.
Doing just art.
Just art.
Okay. And just a couple facts about cystic fibrosis for all you guys. Since this might be new to you, we've got 1 in 31 people are carriers, so not all that uncommon. I was expecting it to be a much higher number. 30,000 people in the United States have cystic fibrosis. We have 2,500 lung transplants in 2021. 2/3 are bilateral, 3% of all organ transplants. You've also had a liver transplant, so you're twice blessed. And there's 3 times, well, 2 lungs and liver. So we've, and about 9,500 of those every year. So you've been through a lot, having been through all this. So here's your timeline. You were diagnosed in '76, and you had your first double lung, and then your second double lung, and a liver transplant, and then with the first one, you started painting about it.
Right.
So let's talk about that. What about going through this brought you to painting? And while you're talking about that, maybe talk about the title and how the cystic fibrosis plays into all that.
Okay. Well, I've spent tons and tons of time in and out of hospital from a very young age. And when you're just sitting there, unable to be active, I was a very active teenager. I still am. So I found other outlets, which tend to be art. Even from a young age, I'd just sit in the hospital and draw or paint or whatever. And then in 2011, I learned that my lungs were not going to last much longer. And at that point, I decided to go with transplant and got on the list. And while I was waiting on the list, I really could not breathe. I couldn't do anything. I was on oxygen. It was hell. And then you're facing this idea like this could be the beginning of the end. Like you have no idea if you're gonna live another 6 months if you're lucky. And at that point, I just started painting. And that's when I started painting the lungs. I painted pretty much what I was feeling about like, oh shit, like I need lungs. So I started painting lungs. And then I also had to like feel what the lungs I had already given me, what life I'd already experienced with these really fucked up lungs. And also like what insight of life I've gotten through that. So I just started painting them. And the very first lungs I ever painted, I filled them up with roses, 65 to be exact, and a form of like drowning, because that's kind of what ends up happening to people with CF. We end up basically drowning in our own sputum and with like the scar tissue and such. And 65 roses is also a term used for children who are learning about the disease, cystic fibrosis, which is a mouthful. So they would tell children that it's called 65 roses, which sounds like cystic fibrosis, 65 roses. So that is why I painted the roses to start. That was the very first lung painting ever. And then it just stemmed from there. I just went kind of crazy with the lung paintings.
So the reason we have the gallery downstairs is to show the patient experience. And so for you, was there something about expressing it in a picture that you couldn't do in words?
Absolutely. Yeah, for sure. Words are not my favorite way to communicate. I'm definitely a visual artist. I like to put my emotions and feelings into the paintings or sculptures because I feel like I can tap into those emotions and thoughts more easily without trying to like attach words to the thoughts and feelings. So definitely.
And your title?
A living proof. That's a very loaded title. There's so many ideas around that. I feel like myself, I am living proof that like determination, stubbornness, and just like the fight that you might carry within you can like really take you far. But also the living proof of what you guys will potentially end up doing. All your hard work in the medicine field and research and what the doctors do, like all of that, and the surgeons, I mean, all the aspects that go into keeping somebody like myself alive, like my art is proof that that stuff works. I'm proof that that works. So I'm gonna thank you all now before you get out there in the world and like work in this field. It's needed.
So Dr. Rao, let's start, before we start looking at her artwork, why don't you give us a little history? So when I was growing up, it seemed like anybody with CF made it to 13 or 14, and I know you're older than that.
Very much.
And I have a number of friends now that are in their 50s and later. So what's changed? What are you doing? And what makes you excited?
So to answer that question, I'm just going to give a quick update or a quick history of CF. I think it's important to understand that CF has been around forever, okay? It was in the 16th century that there was a German poem that said, if your child tasted salty, death would surely follow. And that was a homage to the salt that accumulates on people with CF and the salty taste that occurs when parents kiss their kids. It wasn't until about 1938 on a necropsy that the diagnosis of cystic fibrosis came up. And this was done on a 2-week-old infant. And the thing that was found was that the pancreas had scar tissue and fibrotic areas of scar, and those fibrotic areas were filled with fluid, and that's where the name of cystic fibrosis came from. It wasn't from what was happening in the lungs, it was what was happening in the pancreas. That's important to understand because when you hear that name, you're like, well, where's the fibrosis going on? What's happening? There is some fibrosis going on in the lungs, and there's damage from infection in the lungs, and that's what people have problems with. From 1938, the median survival for people with CF at that time was about 2 months. If you were born with cystic fibrosis in the 1940s, they were expected to live for 2 months. It wasn't until the understanding that, oh, there's a process going on in the pancreas and we have replacement pancreatic enzymes and we can supplement that, and that increased lifespan to 6 months. And then when we were able to understand and start getting antibiotics in the 1950s and 1960s, we understood that people were able to live longer and there was infections in the lungs, and that was what was causing problems for people with cystic fibrosis. And it wasn't until 1989, you may hear this name again, Dr. Collins and his colleagues identified the gene for cystic fibrosis as being delta F508 on the chromosome that was identified. Since then, we've had greater understanding of what CF does to the body and where these chloride channels reside. And they essentially reside everywhere in the body. They're found in the brain, the eyes, the lungs, the heart, the small intestine, the skin. So we understand what are the potential problems that occur. Fast forward to different antibiotics, different therapies, and we talked a little bit about the infection in the lungs. It causes a thick mucus production in the lungs. So there was a medication called Darnase alpha that was made in the 1990s, and this helped break up the mucus so that the accumulation of mucus in the lungs didn't occur. And that increased life expectancy up to 12 years of age, okay? Now we fast forward with the understanding, and now with the newest medication that's come out with targeting the actual protein that's malfunctioning in people with CF, the cystic fibrosis transmembrane receptor protein, which is responsible for chloride channels and movement of chloride through cells. The medication called Trikafta, which is a combination of 3 different drugs, not only increases the production of the chloride channel in the ribosomes, but stabilizes the chloride channel in the cytoplasm, and then stabilizes the chloride channel in the cell membrane itself. And I'm sure you guys will get this when you get to your course on lungs and cystic fibrosis. So now the expected lifespan for people with cystic fibrosis has gone up to currently at 48 years of age. And those that in the next 5 years are born with cystic fibrosis, the median life expectancy is going to be about 70 years of age. Okay? Just a proud moment if I could. I know of no other illness that's in medical literature other than the possibility of sickle cell anemia that has made such great progress in not only understanding the disease, but having medications, and then we are on the verge, similar to sickle cell anemia, of having gene therapy for cystic fibrosis. So there's great progress that's going forward in this.
We're born at a good time.
Now would be better, probably.
Yeah. All right, well, we're going to start looking at your artwork. So this one, this is on the title wall. If you guys haven't seen all the artwork downstairs. I really like this piece because it's, like, on one hand, it's very, very happy. But then if you really think about it, you're like, oh, that's a lot of medicine. That's a lot of care. So why don't you talk about taking something like cystic fibrosis and making art with it, making something that's beautiful and happy looking in spite of everything you've been through?
Yeah, definitely. Well, this was first inspired just by like laying on a hospital bed and looking up and seeing a plethora of IV bags and like the way they caught the light. Something just registered for me where I was like, there was this type of beauty in it. And then just that imagery kind of like stuck in my mind. And then when I began making this, if you've seen my art, most of it is pretty colorful and happy, even though the underlying root of most of my art is not so beautiful. I have this idea of taking imagery, especially from hospitals, that might have like anxiety attached to it or fear or just unpleasantness that most people see in IV bag. And it was like, oh God, might bring up some kind of memory or trauma. And the idea for me is to kind of switch this idea. Like you look at my art and you're like, oh, that's happy and pretty. And then you notice like, oh wait, it's this other thing. So my idea is to kind of give you another feeling around these symbols And for myself, when I arrive at a hospital, those things to me are not full of trauma. They're not fear or anxiety ridden. I know I'm going to feel better. I look at those items and I'm like, oh, yes. Even blood transfusions, most people are not for it. But I'm just like, yeah, bring it on, because I know I'm going to feel better. So I definitely have a different outlook on a lot of this than the majority of society.
So let's talk about you. You're treating patients in what I know of CF is a lot of you guys have to go in for sort of maintenance.
Right. A tune-up is
Yeah.
what we used to call them.
Yeah. So how is that for you, like having these patients repeatedly come back in? And that's one of the things usually I ask later on, but I'll ask you now. A lot of different specialties require different personality types, I think. And in your case, you're going to see people for a long time. You're not emergency room in and out. So talk about that idea of seeing people on and off and watching them progress over a long period.
So first, this is a wonderful piece. And to me, it also represents joy and angst. The joy is that there is treatment that we can use to help someone with CF. The angst is what I see in the black bag, and it's a little bit of projection. It's like, what don't I know? What don't I understand about the care of CF in an individual that I'm missing? And what is it that is preventing this person from getting better and getting on with their life? One of the unique features of taking care of people with CF is I have an opportunity to have a longitudinal care of someone, of a person that I get to know. As an adult provider, adult pulmonologist, I usually start taking care of someone with CF at the age of 18. And I see, as I am myself getting older, people with CF going off to college, graduating college, seeking a job, talking about having a family, talking about how they're balancing their CF care with having a family, talking about how are they going to plan for today and the potential for hospitalization later on, and also plan for the rest of their life, how to be successful and have a productive life. And productive can mean different things. Happy, work, family, all of those are all productive. And one of the wonderful things that I've learned in taking care of people with CF is the definition of happiness is different for each person. And tailoring care to fulfill that goal is what our role as a physician should be and will be.
I like that definition. I definitely notice in the medical field, those physicians who shape the care around the individual tend to work better for me. I definitely am not a normal, do as I say kind of patient. Yeah, I would do yoga versus physical chest PT. Back in the day, they didn't really like that. And now it's acceptable, but I definitely would push. And having a doctor who could work with me always made the difference.
So let's go to the next piece. And these are all downstairs. When I saw this is how I pictured CF, like you were describing before, drowning, above on land. So why don't you talk about this piece a little bit, when it happened and.
This one came to mind. I was trying to think of if I could pick what kind of lungs I could have like, my first instinct was like, oh, I'd like to be able to just like breathe underwater. And that's when I started painting this. I'm a huge fan of the ocean and water. And that's kind of where this came from, this idea of like, oh, being one with the ocean. And also, the ocean, its salt content is very helpful for us if we're swimming in it all the time, which is interesting. Yeah, that's kind of where that one came from,
So,
being one with the
so
ocean.
you're at Otis, and the thought normally is art school, you should make something pretty, you should make something that can sell, and you're there doing work about illness and not being able to breathe. So what's the reaction from your professors and the other students?
The other students is a great reaction. Some of my professors have told me I have a very limited audience. I didn't know how to take that. I was like, well, what does that actually mean? It's really hard to make art that has meaning to myself, but also try and like shape it to have like broader meaning to a society who has money. Like that's it, it's a hard fine line to try to figure out like, oh, am I going to make meaningful art for myself, or do I figure out a way to like reshape it, still have some meaning, but yet somebody might actually buy it? It's tough. I haven't figured that out yet. Hopefully, by the time I graduate, I'll have the answer.
You're not the only artist who can't figure it out. All right, so this one is beautiful, but I'm not sure exactly what you're saying with it.
I really like this one too. This was definitely experimental. It didn't turn out how I thought it would, as a lot of my art doesn't. But anyways, what I really ended up liking about this one is when I created it, I used an oil clay, which means it doesn't dry out, which you can use to like make molds. And I did that, and then I started putting in the silicone and such, and realized I needed to remove the clay. And so then I'm like dissecting this with a scalpel, trying to remove the clay. And it was very weird because now I'm like cutting this thing like I'm in like a surgery or something. So it became more than just like what it shows for me. It became like this process of like, oh, this is what happens to like my body sometimes. Somebody's in there and like whatever it is they do. So that was kind of just like a fun experiment. And then the outcome I really liked because it does have this like glass element and it like shatters very easily. When I displayed it, not here, I had shattered pieces on the ground to kind of like show like this shattered effect. But I couldn't really put a lot of things on the ground here, so I don't really have that aspect to it. I did want it to maybe look like a lung, maybe just a blob, maybe stained glass-esque. Yeah, it was very experimental.
What's interesting about this piece to me is it's like the light goes through it, it goes through, but at the same time, it's really heavy.
Right.
And I mean, even though I was sort of saying, oh, I don't totally get it, but when you look at it, you get that sense of here's this very solid thing that's also light, which I would think is sort of how you feel at times.
Yeah, definitely. There's like a fragility to it.
I also like this piece. To me, I view this as this is what the lung of a person with cystic fibrosis may look like. Okay. Sorry, I have CF on the brain, I guess. But, you know, there's areas that are healthy, there are areas that are not healthy, and they're all packaged together, and the wire around it shows me that it's a unity of the lung. And it's not the pieces that affect a person, it's the overall image or the overall lung that really counts. You know, there's this relatively new concept of this microbiome in the lung, that one part of the lung may be different than another part of the lung. And this brings back the image that it's the whole piece that really counts, not just the blue part or not just the yellow part that we're looking at here. So it's a very nice piece.
If you get tired of this medical stuff, you could be an art critic.
No. I've got kids in school. I got to pay for.
All right.
This one I did, oh, when did I do this? Oh, I believe I did this when I was rejecting my first set of lungs. Not my original, but the first set of transplanted lungs. And this one kind of just represents like change and how with change there's growth. Like we need change. We need destruction in some aspects in order for there to be newness. That's where this one came from. And then just this idea of like a swirling effect of life and breathing and yeah.
So this brings me back to you. So someone comes to you and they've got a kid that they've noticed is salty or having trouble breathing. So what's your discussion like with them? And then also you've got an adult patient who's had one set of lungs and is looking for this great cure, and then it starts to go bad, and you've got to have that discussion of, we got to do this again. There's a lot of pressure on you.
I'm fortunate I don't take care of pediatric patients. So my conversation is slightly different when I have adults come from the pediatric world with CF, come to the adult pulmonologist. It's a little cliche, but my conversation starts with, so you have CF. How has CF affected your life? Okay. And it really that question serves two purposes for me. One is it reframes the conversation as CF as sort of a matter-of-fact kind of illness. And it's not to say that I'm brushing it under the rug, but it's to say that this is something that you as an 18-year-old have lived with all your life, and you are the expert in this. And I need to get a glimpse of how you're living that life with this illness. The second part of that answer that I get is it gives me a framework of what that person understands about CF, where they are in their journey through the illness and through the medical therapies that they have, or what they are doing or what they're not doing, okay? And it's a junction point where I can meet that person and say, okay, this is what you're having or what you're doing, and let's go from here together down this path. The second part of that question is having gone through a transplant and understanding that transplant is potentially limited in what it can provide. And there may come a point where the transplanted lungs either become infected or go into rejection because they're foreign to the person's body. It's always on our mind that, are we hitting that end of the road on this lungs here? And it's a tough conversation. And it's a conversation that you have more insight than I do, and the feelings that revolve around, I've been down this road before. Am I willing to take that same route to get another transplant? And all of the angst, the pain, the potential complications that go on with transplant. So I'm going to defer to her for the expertise.
That was a very traumatic day learning that I was in rejection. I didn't feel bad. climbed 7 flights of stairs, no problem. And then the bronchoscopy showed rejection. And that is like the word you never want to hear. Like that just like, you never want to hear that word ever. And so at that point, I was just like, okay, now what do I do? Like, I just went into like, okay, let's solve the problem. And my doctors at that point, this was in San Francisco, were not willing to do a second transplant. And at that point, I just called every center in the country. I just started calling everywhere because it was, I'd lived my whole life not being able to breathe. Like, I walked anywhere, I'd have to like stop and cough a bunch. Like, I just couldn't breathe. And now I've actually experienced life with the ability to breathe. Now I had like ability to do anything because I could breathe. And now I'm told, oh, it's over. And I was just like, oh, no way. Like, I can't, like, a year of just this is not enough. And then I found a place. I went to Duke for the second transplant. I packed up my car and drove across the country and moved and got new lungs. That was a nightmare. But yeah, it was weird. Like, had I not ever had the first transplant, accepting this idea of like, okay, you're at the end was so much easier than, oh, here's a little taste of what it's like to be able to breathe. And then it's over. I couldn't take that.
So I might be wrong interpreting the work that's downstairs. I don't think you dealt with this, but like Dominic does, another artist with cystic fibrosis, the fact that you being here is because someone else died, like you got lungs, and that's, I would think that would sort of play with your head a little bit.
Yeah, I did. I think the first go around, I was really like traumatized and like really upset about this idea that I basically was just waiting for somebody to die, and I'd hear an ambulance and like, I don't know, it was hard the first go around, definitely. And I felt guilty, like, oh, I'm just sitting here waiting for somebody to die, which is kind of rude. But after the first go around and then the second, now the third, it's just kind of, I've just accepted it, I guess. I don't really have any like guilt like I did before. And gratitude, I feel like gratitude can really cancel that out. And to do everything I possibly can to stay healthy is a form of gratitude.
Well, it honors them.
Right.
They're still alive if you're still alive.
Yeah, and to not, not sit around and feel bad for myself, like, oh, I've been dealt a really shitty hand, but I'm like doing stuff, I'm out living my fullest. And I think that's like a big part of dealing with the idea that other people's lives were lost for me to be alive.
So part of your fullest is making art. So let's talk about this piece.
This one is all made from like natural fibers, either raw felt or wool strings, and oh, there's wire too. I wanted this idea of like the lines or the bronchioles, how there's kind of like line or tree lines, and like there's the layers and layers of like breathing in and breathing out, and the layers of hospitalizations and the scarring. I don't know if this photo shows it very well, but towards the bottom of the lungs is a bit darker. That was to represent like the scarring and the infection that has taken, that happens over time with the CF lungs. And then the raw felt with the green kind of represents like just mucus. I mean, CF people are mucus machines. It's so gross, but it's real. It's real. This one is, it's conceptual. It would represent like the rib cage, like the white, pieces would be the ribs, and the black strings represent the wires that are holding my sternum together. And just this little wire is keeping like all of this life concealed and contained, which is like, which I represent with the colors. And the colors also, again, represents breathing in and out and life, and what, just how much life we get with breathing.
What's interesting about the way you're depicting this is you've got a very literal piece of the underwater. You've got this, which is pretty abstract, and then this one, which is particularly literal, I would.
Yeah. I believe our connection with trees is like really tight. It's a very tight connection because of the interaction that we have as far as like oxygen and carbon dioxide. Yeah, okay. I was like, so, and the shape of the lungs and the shape of trees, like it's just kind of trippy how it's so similar and how necessary we are to one another. And so I definitely add a lot of trees along with my paintings. And I then started getting into the skeleton. And I'm just like really exploring adding the different parts of the body. I'm trying to go a little away from lungs too as I like expand my art, because it's a whole. It's all connected.
So it's interesting that we've found the common theme. I use the analogy of a tree to explain what's the anatomical, physiological parts of lungs. I say that the trunk is the airway, the trachea, and I say the branches of the tree limbs are the bronchioles that divide into right and left. And then the leaves on the tree represent the alveolar sacs where oxygen and carbon dioxide exchange. So that analogy that you depicted here is so true and translates to sort of the talking points that I have with people with CF and say, listen, with CF, we're talking about the branches being affected. We're not talking about the leaves being affected. And if we can somehow get all the mucus and the junk and the sticky sap that's in the trunk or in the branches out of the way, then the leaves can work better, okay? And I think that's a perfect representation of that.
This is my raven piece. The background is like EKG lines. I have this idea and the other beliefs that a raven has the ability to cross over between the underworld and this world or spirit world. And I kind of like that idea. I kind of feel like I'm that kind of a person who kind of straddles the line between life and death. And this represents that. And the idea of like being so close to death so much of my life that you have a different like perspective on life. Like knowing death allows you to have like a clear vision of life. It's kind of trippy. So that's what this painting represents. This one represents slides that one might use in a microscope to look at all the gunk and different stuff that our bodies produce. And I really like this one when there's like a breeze and you can see like the movement and the shadows changing, because it, for me, represents how things are constantly changing, even though we might take a sample from the body or whatever, there's still like change. There's always like a continuous change. And then with research, I mean, just in my lifetime, the research around CF is just like dramatically changed. And this piece kind of represents like the time and the efforts that people put into the research. And then it's always changing. There's always more information.
Okay.
This lady, She kind of represents many aspects of myself and my lived experience. First off, she is transparent, and as I'm becoming an older person in this society and an older woman at that, I'm starting to feel a little bit more invisible, and I never really knew what people meant by that, but now I'm like, oh, I'm getting it. But not only that, but her legs being extended also represents a time period when, like, I was in the bed, couldn't move, couldn't talk, couldn't walk, couldn't hold anything with my hands. I was just like there. And there's this idea that when somebody's ill, a lot of people will speak for you. Even if you have the ability to speak, a lot of people will speak over you. You are unheard a lot of the times just because you're sick. And I get really frustrated with that because I'm extremely opinionated and very outspoken. And to get shut down simply because my body is doing weird things, I am not a fan of. So then there's that. And then on top of that, I do have an invisible disability. So if you saw me walking down the street, you would have no idea any of these things that I've experienced. So she kind of represents a lot of those things by being invisible, also being hung upside down, as maybe back in the day, a lot of women were titled witches because they were unmarried or they used herbs or whatever. So there's just this concept of not being seen, but seen to where it's a bothersome.
All right, so we're almost out. I'm gonna,
Could I just give you
Oh,
a
of
different
course.
interpretation from my
I'd
perspective?
love to hear it.
I thought this was a very powerful piece, and it reminded me of how impersonal, how invisible that people can become in the ICU or in the hospital. How they no longer seem as a person, but they seem as the diagnosis or the problem that they're having, that we need to sort of be transparent through them and get to the underlying problem. And it made me really think, how often do I go through the ICU and not see the person, but see the problem? And I think this is a very powerful piece.
You?
So that's one of the things I talk about a lot, is something that is a major singular issue for her or any patient is something that can become really routine for you. You know, I always say, like, somebody gets a lung transplant, that could be the one big thing of your life, but you see it 3 times a week. So how do you not become jaded and forget that it's the biggest event in her whole life?
Yeah, that's always a difficult thing to do. You know, we're taught through medical school, through residency, through fellowship, and to solve a problem. Always taught that what is going on here, how do I fix that problem? And sometimes it takes a true multidisciplinary approach to get that whole picture and have a team of people taking care of someone to stop and listen from a different perspective, to go back and say, this is not a problem, this is a person, okay? One of the most brilliant things that happened with the Cystic Fibrosis Foundation accreditation and so forth was establishing a multidisciplinary team that involved a pharmacist, that involved a social worker, that involved a respiratory therapist, that involved a nutritionist, so that as a physician, you could take input from all of the other knowledgeable people in their area of expertise and put the pieces together to make the whole person again, and not just delve into the single problem that you're trying to solve. I think it's one of the take-home messages that I've learned, and I try to teach to my students, that it's not a problem, it's a person that you're dealing with.
You have a final comment before we wrap things up here?
I think that's great. I definitely believe that any medical problems that you have to deal with, if you address the person first, the medical problem will be a lot easier to solve.
All right, well, thank you both so much.
Thank you. Thank you all, and thank you especially, Dr. Rao, your final comments about multidisciplinary teams and seeing from different perspectives. I think that's certainly what the HEAL curriculum is all about, core and these co-curricular events where we get to see wonderful artwork that helps us look at a situation, a person from a different perspective. So thank you, everyone, and stay tuned for more. Thanks.